In this video, I'm going to show you the most common signs and symptoms of diabetes so that you can get a head start in detecting it and getting treatment. If you're new to me, I'm Dr. Dwayne Wood. That's Wood with an E. The E stands for endocrinology. And here on the channel, I help to educate you, empower you, and encourage you to take charge of your health and your life, avoid complications, and live a healthy, fulfilling life, going to the next level. Each November is designated as Diabetes Awareness Month, and that you've caught us in the middle of that month. During this month-long campaign, health experts strive to educate the public about the realities of diabetes in the hopes of dispelling some of the myths that surround the disease and prevent the progression to diabetes for patients who have prediabetes or who may have some risk factors. This is with the intention of helping those people who live with diabetes and the public in general to live a long, happy life. So that's what we're doing here tonight. If you've not already done so, we've done, this is day number 6 of our month-long series on diabetes. Go back and look at the other videos that we've done. We've talked about type 1 diabetes, type 2 diabetes. We've talked about what diabetes is and how to get it diagnosed. And tonight on this episode, we're talking about the signs and symptoms of diabetes. So glad that you guys are here. And let's make sure that we are, there we go. Just had to pull me up on the other screen there. So if you've not already done so, go ahead and look at those other videos. And we are walking through diabetes, basically diabetes 101, right? So all the things that you wanted to know about diabetes, we're going to be unpacking them here on these brief videos that we're doing throughout the month. Not very long, but hopefully as we do each of the segments and put them together, you'll have a good resource, not just for yourself, but if you have family members or people that you know in your neighborhood, in your community, you can use this as a resource. Okay, so that's what that's what we're planning to do as we go through. I keep saying we, but that's what I'm planning to do. There you go. What are the most common signs and symptoms of diabetes? That's what we're talking about tonight. And we're just going to go through, right? Now, this is not an exhaustive list, but these are the most common things that you will see. And so let's make a distinction between signs and symptoms, right? So signs are things that people see, and symptoms are things that people complain about. So if you have a skin finding, right? So somebody looks at you and said, hey, you have X on your skin, or you, and we'll talk about some of those things, then that is a sign. And then the symptom of things that you will complain about, okay? So just wanted to make that distinction for you, this idea of signs and symptoms. So numbness, numbness, painful or tingling hands or feet. Numbness, painful, tingling hands or feet are the things that you will see or you will feel, right? So the most common things that people talk about is, oh, my feet are numb, my feet are painful. And that is one that is very common. And it's one of the triopathies, right? So retinopathy, neuropathy, nephropathy. So neuropathy, that's what we're talking about here, numbness, tingling, and burning. And is a very common thing to see in patients who have diabetes. And then the next one would be blurry vision, right? So now we're talking about the effect of the eyes. And remember, as we're talking about the symptoms, the reason that we're having these symptoms are because the diabetes, the high blood sugar, is affecting everything that's going on in the body. All the cells are being affected by high blood sugar, okay? So even though we talk about the triopathy, retinopathy, neuropathy, nephropathy, there are so many other parts of the body that are affected as well, okay? So numbness, tingling, burning, hands, toes, fingers, or feet, right? One of the questions I ask for people. And then, of course, blurry vision. Next, and if you if you saw our short that we did on the 3 Ps, the 3 Ps of diabetes: polyuria, polyphagia, and polydipsia. So polyuria simply means peeing a lot. Polyphagia means very hungry, and polydipsia means drinking a lot, right? And these are all things that happen because of the high blood sugar, right? So the high blood sugar, as the body is trying to get rid of excess sugar, it makes you pee. right? So that's why people are running to the bathroom all the time. Because they're peeing a lot, they become dehydrated. And so we've got polydipsia, so they begin drinking a lot. And because the body is not able to use the sugar that they have in their system, right? The high blood sugars are not getting into the cells. The cells don't have energy and they begin making you hungry. So that's where we get the polyphagia, right? Polyuria, polydipsia, polyphagia, right? Some of the most common signs and symptoms of diabetes is what we're talking about. And then fatigue, right? Unexplained fatigue, unexplained tiredness. You just can't seem to get enough rest. And one of the reasons for that is going back to the idea that even though the blood sugars are high, there's all this energy in the body, the cells can't use them. And if you go back to our original discussion about what diabetes is, because the insulin is not able to get sugar into the cells, either because you don't have enough or don't have insulin in type 1 diabetes, or the insulin is ineffective. That's our type 2 diabetes. And then there are some skin findings, right? So this would fall under the sign, right? So things that people can see, skin tags. And that's what you see there on the left. You begin developing skin tags, typically in the neck, in the axilla, so the armpits. And then there are some discolorations that you will see. And these are typically, once again, in the neck, skin folds, under the arms, in the groin. And this is called acanthosis nigricans. And sometimes, you'll look at the neck and, parents would think, oh, the kid didn't wash their neck, or that they're dirty, or even adults, right? But it is a finding due to insulin resistance. And so because the insulin is there, it begins causing changes that we see in the skin, and they show up as the skin tags and then acanthosis nigricans. And then unexplained weight loss. Now, this is an interesting one, because a lot of times people will come in and they'll say, well, I've been exercising, I've been eating better, and I am losing weight. And say, well, how much weight have you lost? And they give whatever the number. But the reason that people lose weight is going back to this polyuria. Remember, these blood sugars are high, and the sugar is not able to get into the cell. So once the blood sugar gets to a certain level, the body tries as best as it can to get rid of that excess sugar, and it makes you pee. Well, what is sugar? Sugar in the body is that's energy, and those are called calories. So as the body is trying to get rid of excess sugar, peeing out those calories, then people begin losing weight. So, and say, well, isn't that a good thing that they're losing weight? Well, they're losing weight, but it's not a good reason, and it's not sustainable, right? Because it's not sustainable. It's not a healthy way to lose weight, and it can cause other problems as well. All right, and then dry, itchy skin. Now, one of the concepts to understand about diabetes is that, and let me pop over to this screen. So one of the concepts to understand about diabetes is that when the cells can't get enough energy, those cells begin to die, or those cells begin to work ineffectively. For instance, in terms of our immune system, the immune cells, they slow down. They're supposed to be able to get to a particular area in the body quickly and do their job. But because of diabetes, everything is slowed down. So cells in the body don't function the way they're supposed to. In this case, because the cells don't have enough energy, they don't turn over, and they're not healthy when they do turn over. So they're supposed to turn over with some regularity, but because they don't have any energy, they stay there, and those cells become dry. And if they become dry, you get itchy skin, right? So there's a reason for all of that, and it all has to do with the fact that the body is unable to use the energy that it needs, right? Even though you have a lot of energy in the body, and we'll talk about that in another one of our videos. So dry, itchy skin. And then this goes back to what I was just talking about, right? So cuts and sores, they don't heal well. They heal slowly. And this is the reason sometimes that you will have scarring, right? Because the body is supposed to rapidly get to an area, and fix it, right? Fibroblast is supposed to go down, and I won't get into all the details of that, of how that happens. But because it's slow, that cut stays there, that sore stays there, and when it does heal, it becomes a scar, right? Because it's been there for so long. The other thing that happens in this instance is that because it's open for longer than it should be, then bacteria can get into there. And that is where we get some of the infections that we see with diabetes, because it begins setting up an infection when it should have closed off immediately. Those cells are so slow that they don't do their job. And then irritated gums, right? This is one that we don't talk about a lot, but having irritated gums, dental issues, issues that you wouldn't typically, let me back up and say it a different way. So issues in the gums that would normally be handled more effectively, it doesn't get handled because of what we've been talking about. Those cells, the entire body is slow, right? And so you can see that patients with diabetes can have irritated gums and some other periodontal diseases, and we won't get into that right now. That would be an interesting conversation to have, to bring someone on, one of the dentists, one of our local dentists, or anywhere. So if you're out there, if you're a dentist and you would love to come over and talk with us, that would be great, okay? And then erectile dysfunction. Now, it is a huge issue for couples. It's a huge issue for our men, because diabetes affects every cell in your body, including nerves and including blood vessels. And remember, for erections, you need working nerves and you need working vessels, right? Because the penis has to engorge with blood, and then the nerves help to maintain that, right? So if we're not having good function for our cells, then erectile dysfunction happens, and that leads to relational problems. It leads to depression. And there's just a whole host of other things that begin happening there. Okay. And then yeast infections. Remember, blood sugars, when you're beginning to pee, right? What we're doing, we're putting sugar in the urine, and yeast like warm, damp places with lots of sugar. And so that's what we're doing when we are, when we have high blood sugars. The body begins peeing, and so you can have yeast infections. Okay. So that is a list of not all, but some of the most common signs and symptoms that you will see with diabetes. If you're out there right now, go ahead and give us a thumbs up if you're enjoying this video. If you are enjoying what we're doing on the channel, what I'm doing on the channel, go ahead and give us a thumbs up, and I'll come back and I'll talk about that a little bit more. But right now, we are going to our amazing question wheel. All right. So you remember our amazing question wheel. So these are the rules. You see the wheel on the screen. I'm going to spin the wheel. It's going to land on a question, and I'm going to answer that question. Okay. So I'm going to give you as detailed an answer and as practical an answer as I can. But here are the criteria. I've got to do it in 45 seconds. That's right. In 45 seconds. And then once I finish doing that, then we're going to use that clip, the answer that I give, to create a segment, a short video that we're going to put out on all of our social media platforms. So once you're going to see it created here, right, in real time. And then I want you to go out and find it wherever it is. And I want you to put in the hashtag I was there, right? Hashtag I was there. No spaces in that. Hashtag I was there. I'm going to actually, let me see if I can put that in here. So hashtag I was there. Okay, that's what I want to put. I was there. All right, so let's see. Let's go ahead and let's spin the wheel. If I get my mouse over there. Come on. Here we go. Let's spin the wheel. And round and round and round and round it goes. And let's see, where do we stop? Where do we stop? Where do we stop? So this is an interesting one. So how often should I replace my glucose meter? How often should I replace my glucose meter? All right, let's go ahead. Let's get my timer up on the screen, and I'll start talking as soon as that timer comes. Now, if I am able to finish the question, right? If I'm able to finish the question, then nothing will happen. I'll be just switched back. But if I don't finish the question, it's going to just move on to another screen. So let's see. I should be able to do this one. All right, here we go. You ready? If you're ready, say some thumbs up. If you're ready, say I'm ready. If you're here, say I'm ready. Okay, here we go. So how often should I change my glucose meters? Well, glucose meters only should be changed when they are not functioning. And so meters are designed to really last a long time. And so unless you're having significant issues with it, and when I say significant, it is not working, or you have some question about the results that you're getting. And even in that case, you can test it against another meter. But you shouldn't have to change that very often. They're designed to work for a long time. Okay? All right. So I think I did that. I think I was able to get that, right? I had another, maybe, I'm not sure how many seconds I had, but I think I did it within the time. Yeah. So awesome. All right, that's our amazing wisdom wheel, question wheel. And like I said, I want you to go out there, and if you're here, or even if you watch this on the replay, right? Hit replay in the video, this video, and then go find it. We're going to post it on all of our social media platforms. Dwayne Wood, MD, is our handle. If you could go to any of the platforms, TikTok, Twitter, LinkedIn, Instagram, you can search and you can find us under that handle. So although diabetes is a devastating disease, we can still beat it. Number one, learn all you can. And that's what I'm doing on the channel this month. I'm educating for a change. Learn all you can. If you have any of the symptoms or any of the signs that we discussed tonight, talk to your healthcare provider. Remember, we can delay the progression to diabetes, and we can effectively treat diabetes. We can help people get into remission with their diabetes and avoid complications living a long life. Share this video with your family and friends, like it, subscribe to our channel, and come back to the other sessions that we're going to have as we move through the month. That's our call to action for this month, right? For this video, for this episode. For subscribing, let me walk you through that. Subscribing, if you go to YouTube, create an account. It's free. No money involved. Go ahead and hit the subscribe button and also hit the bell, because if you want to know when we're putting new videos out, when we go live, when we're doing things on the channel, you want to make sure you hit the bell. Okay, so create a free account, hit subscribe, hit the bell so you get notifications. And then when you see those things pop up, come on over and hang out with us. I am educating, I am encouraging, and I am empowering you to take charge of your health, your life, avoid complications, and go to the next level. See you at the next video.